I'd like to thank you all for being here today while I present my strategic plan for equipping community care nurses with smartphones. I'd like to thank the members of Providence that are here, those members from the larger system, as well as our members from Elder Place that are here. Providence is the third largest not-for-profit health system in the United States, and we are committed to providing quality care to our participants and patients. Our system has over 82,000 caregivers. Those are those employees that are out there touching the lives of our patients every day. We have a wide range of services and very diverse populations that we serve. We serve those from birth to end of life. But it's interesting to note we touch more than 5 times as many people in the non-acute community care setting as we do in the traditional hospitals. And that's why I wanted to focus on Elder Place and our community care nurses. Providence Elder Place is an innovative program that's known as PACE. It is a program of all-inclusive care for the elderly. The community center, our day and health centers, are the heart of Providence Elder Place. This is where our members come to receive medical care, socialization, recreation, as well as therapeutic services. This is what makes Elder Place stand apart from other organizations. I would like to present my strategic plan for implementing the use of smartphones. First, I'd like to tell you why. We can improve our interdisciplinary team process. Our IDT is at the heart of how we function at Elder Place. This will improve communication, the speed at which we can communicate, as well as improve patient safety. We can increase operational inefficiencies, and we can improve our quality outcomes. How do we do this? Well, it's the rate at which we share information and the different types of information that we can share. And by types of information, I mean charting in the electronic medical record, as well as texting on a secure line directly from nurses to physicians in the clinic. Another opportunity that gives us is to upload photographs in a secure manner, allowing the nurses to show the physicians exactly what they're seeing and assist our participants in a much greater fashion. Now, there are some challenges, I recognize this. It's not going to happen overnight. So it will be a drawn-out implementation as we purchase cell phones, assign them out, equip them with the appropriate security, working with our IT departments as well as our security departments. So that will take time. Right now we have minimal system integration, so we're all using the same technology and they're not always linking together. But the nice thing is we have plenty of resources available to us, and because we're at the beginning of this process, we're able to access those professionals who have expertise in that area and ask questions and kind of get a little extra help with that. We're going to be able to create exactly what works for us. Some staff might be resistant to this technology as well. Maybe they're just unfamiliar with it. To help us with that, we will identify those team members who have strengths in technology and have mentors. So the key to the success of this strategic plan will be communication and education. We'll have formal in-servicing monthly at the all-nurse meetings, as well as the individual sites. Informally, we will offer brown bag lunches, at which time nurses can come in and ask questions, play with the technology in a non-threatening environment. And of course, we will also communicate with those a little further out in the process and our community partners through email, and we'll update our patients and participants in our quarterly newsletters. One nice thing is that we will have support from the larger system. Thank you very much. And this will allow them to analyze and monitor us for legal compliance. And we'll also have the IT and IS support that I already mentioned because it's already in place. Another benefit to having the larger system is having those community partners that we already have a well-established relationship with, So this will allow us to purchase the cell phones that we need at a better cost. So thank you to the bigger system. So who's going to benefit from this? Well, definitely our patients and our caregivers. These are the people that are in those residential care settings or those adult care homes. But it's also going to affect our interdisciplinary team, the doctors, the nurses, and anyone who comes into contact with that medical record, giving us information about the people we're serving. By increasing the amount of information that we can provide and the speed at which we can provide it, everyone will benefit. So, CCRNs ultimately will be able to provide our patients and our community partners that are caring for our patients with a solid care plan in the moment. When they leave that situation, they'll be able to communicate quickly and effectively with the patient, the caregiver, as well as the physician that's back at the clinic. So equipping our CCRNs with smartphones will provide better customer experience for everybody that's involved. And in the end, it's going to increase quality outcomes and improve patient safety. Does anybody have any questions? Thank you.